If we're dealing with structural issues, major structural issues, for example, a baby is a breech delivery, right? And they get pulled out and hypermobilize the sacroiliac joint. That creates compensatory structural patterns. You may see that. Another situation where a kid under 18 months may be a structural issue is that a little baby that was brought in because they went flying off the changing table and smashed onto the floor. They actually had some structural issues. I had another baby. Mom was walking down the stairs, stepped on her night coat. She was wearing a nightshirt, and propelled the baby down the entire flight of stairs. The baby just went flying down the stairs. Structural issue was the primary issue. So the indicators showed up those particular issues. We find those, we start with these type of adjusting protocols. Again, the SOR is usually clear in that case because it's an underlying structural issue. So I'm going to start to work right away from the sacral structural issue. As Kevin asked before, these are the cases where you can use the trapezius fiber. I still, in infants, tend to use the occipital fiber. But with a 3-year-old, let's say I had a 5-year-old, they brought him in. He came in like this, like an old man. He was playing on the swings with his friend, and his friend thought it'd be cool to be Superman. His friend flew off the swing, landed on both feet, and walked away. And he thought that'd be cool too, except he forgot to put his feet down. So he landed on his sacrum, went flying off the swing, and right on his sacrum. Okay, so he was basically gave himself like a 5-year-old category 3, bilateral antalgically and all that. So there are situations where you use that. So trapezius fibers or occipital fibers, again, cervical evaluation. Here's where the RNC factors come in. If you're working with a primary structural issue and you start to adjust the cervical spine and you find that the cervical spine's not clearing out the way you think it should, especially if you're like a 3, 4, 5-year-old, check your RNC factors because there's a good chance that what's happening is that your reflex fibers creating that a compensation to the lumbar spine. Correct the RNC factors, which is by correcting the lumbar spine, the cervical spine will clear out. It's not uncommon to see that when you're dealing with a structural issue. That's why those RNC factors are sitting down.